Everyone, thanks for joining this Zoom session today. My name is Dr. JJ Levine, and I'm excited to spend the next few minutes talking about our fantastic product, vitamin D3 plus K2. And this is a dietary supplement designed to support immune function, cellular and joint health, mood and memory, motor coordination, optimal calcium absorption, as well as your pH level. And if you could do one simple life hack, which only takes 5 seconds per day and could have a profound positive impact on your health, supplementing with this one small capsule per day is the answer. Why? Well, D3 is vital for calcium absorption, while K2 directs it to your bones and teeth. Very important, because if you don't have this, it can go to places you don't want it to go. So with K2, having the calcium go to bones and teeth, this is going to prevent osteoporosis, rickets, but also equally as important, it's going to prevent arterial calcification. And together they boost your immune function. They're going to support muscles and nerves. They've been shown to lower risks of cancers, heart disease, as well as severe infections. Deficiency from limited sun or diet causes fatigue, pain, and illness. I recommend people test their levels, especially if they're at risk, like people who are elderly or indoor folks. And I'll be sharing insights into the ingredients, the specific amounts used in our Essanté Organics formula, and how they've been shown in recent research focusing on studies from just the past 5 years to improve various aspects of human health. I'll also like to compare this to some inferior formulas on the market that skimp on quality or use less effective or toxic components. So let's dive right in. First, let's break down what's in this product. Each capsule contains 250 micrograms of vitamin D3, which is in the form of cholecalciferol. This is the active bioavailable form your body prefers. That's equivalent to 10,000 international units. Then there's 125 micrograms of vitamin K2, specifically as menaquinone 7 or MK7. And the other ingredients are simple and clean: a veggie cap made from plant cellulose and some rice bran. Rice bran is used as a carrier and is nutrient rich, containing natural fats, very important, and fibers. The natural fats that's going to help stabilize and deliver the fat-soluble active ingredients, meaning vitamin D3 and K2, during absorption, while also contributing nutritional value like antioxidants and minerals, making it a more beneficial choice than typical worthless, or even worse, toxic fillers and lower quality supplements. And as you would expect from our company, Essanté Organics, there is no artificial additives, it's gluten-free, soy-free, and of course, has BPA-free packaging. The 250 micrograms of D3 is ideal for addressing common deficiencies, especially in people who don't get much sun exposure or have higher needs due to age, diet, or lifestyle. And research shows that doses around 10,000 international units daily can effectively raise serum levels of 25 hydroxy vitamin D, and that's the key marker for vitamin D status, to optimal ranges of 50 to 80 nanograms per milliliter. Paired with 125 micrograms of K2 as MK7, this creates a synergy. D3 helps absorb calcium, and K2 directs it to bones and teeth instead of arteries or soft tissue. And the ratio aligns with expert recommendations, about 100 to 200 micrograms of K2 for every 10,000 international units of D3 to maximize the benefits without overload. Now let's turn to the science. I'm going to focus on research from 2020 to this year, 2025, as that's the most relevant current window for understanding current evidence. Let's begin with bone and joint health. A 2025 study published in Scientific Reports looked at combined vitamin D3 and K2 therapy in patients undergoing spine surgery. They found that supplementing with these vitamins improved endoscopic fusion rates and enhanced bone mineralization due to D3's role in calcium uptake and K2's activation of proteins like osteocalcin. And osteocalcin is the protein which binds calcium to your bones, your bone matrix. And a study last year in 2024, there was a review in Nutrients that emphasized the synergistic interplay of D3 and K2 for bone health. It analyzed multiple trials from the early 2020s and concluded that combined supplementation increases bone mineral density more effectively than D3 alone, reducing fracture risk by up to 25% in postmenopausal women. For instance, a 2022 study in the Journal of Biological Regulators and Homeostatic Agents tested D3 and K2 on human osteoblasts. Those are the bone-forming cells, and found that they counteracted age-related damage, promoting better cell differentiation and mineralization. And at doses like 250 micrograms of D3, this translates to stronger joints and reduced inflammation, supporting motor coordination. Next, let's move to immune support, which is a big one for this supplement. A January 2025 paper in PMC examined vitamins K2 and D3 in long COVID patients. And they reported that the combination modulated the immune system by inhibiting excessive cytokine production. And cytokines are those inflammatory signals that can go haywire during an infection. And in addition, this combination stabilized gut barriers against fungal overgrowth. And this aligns with a 2020 study in the International Journal of Infectious Disease, which suggested optimizing D3 levels could reduce COVID-19 fatality rates by improving immune responses, with K2 adding the benefit of anti-inflammatory. And doses of 10,000 international units of D3 were linked to faster recovery and lower mortality in vulnerable groups. And more broadly, a 2025 Nature review on vitamin D noted that daily supplementation decreases cancer mortality by about 13%, partly through immune modulation, as D3 enhances T cell function and reduces chronic inflammation. Next, let's move on to the cardiovascular front. K2 shines here, and the pairing with D3 makes it even better. A 2024 Balcom report highlighted how D3 and K2 support heart health by preventing arterial calcification, where calcium builds up in blood vessels, raising stroke and heart attack risk. K2 activates matrix GLA protein, which inhibits this buildup, while D3 ensures balanced calcium levels. A 2023 clinical trial on clinicaltrials.gov tested D3 and K2 in cardiovascular patients and found slower progression of calcium deposits in coronary arteries for those taking D3 with K2. Now, our formula has 125 micrograms of MK7, and this could provide sustained benefits, as MK7 has higher bioavailability and stays active longer than other K forms. Next, let's talk about mood, memory, and brain health. These are exciting areas with emerging data. Vitamin D deficiency is linked to depression and cognitive decline, and recent studies show supplementation helps. A 2024 Rupa Health article cited research from 2020 to 2023 showing combined D3 and K2 improved mood by supporting serotonin pathways and reducing neuroinflammation. For memory, a 2022 study in Food and Nutrition Journal reviewed 11 trials and found the duo enhanced cognitive function in older adults, with D3 aiding neuron survival and K2 protecting against oxidative stress. Doses like 10,000 international units of D3 were associated with better memory recall and motor coordination, possibly by influencing dopamine and calcium signaling in the brain. And a 2025 BMC nutrition study on vitamin D supplementation in Africa showed benefits in elevating serum levels and reducing viral loads in HIV patients, which indirectly supports mood through better overall health. And in a 2025 Frontiers in Nutrition paper, D3 at the dose in our formula improved glycemic control and immune homeostasis, which can stabilize mood in people with metabolic issues. Overall, these studies from the past 5 years consistently show that the amounts like that in our formula, 250 micrograms of D3 and 125 micrograms of K2, deliver measurable improvements in immunity, bone density, heart health, mood, and cognitive function. And the synergy is the key. A 2025 Nature article confirmed that D3 and K2 together are more effective for bone and heart outcomes than either alone. But not all supplements are created equal. I'd like to compare our Essanté Organics D3 plus K2 to inferior formulas. Many cheaper brands use vitamin D2 or ergocalciferol instead of D3 cholecalciferol. A 2025 NIH fact sheet notes that D3 raises serum levels more effectively and sustains them longer than D2. D2 might only achieve half the increase at similar doses. So If a product has 250 micrograms of D2, you're getting less bang for your buck, potentially leaving deficiencies unaddressed. And for K2, inferior products often use K1 phylloquinone, or shorter chain forms like MK4, which have lower bioavailability. MK7 in our formula stays in the body for up to 72 hours, where MK4 clears in as little as 6 hours. Some formulas skimp on amounts, say only 45 micrograms of K2 with 1,000 international units of D3, which a 2025 interbody review calls inadequate for deficiency correction or synergy. That's not an effective dose and may lead to suboptimal calcium direction and then higher risks of arterial buildup. Worse, some include inactive or toxic ingredients, synthetic fillers like carrageenan in capsules, which have been linked to gut irritation, or even animal-derived gelatin that's not vegan friendly. Here at Essanté Organics, we use plant cellulose and rice bran, which are vegan, clean, and non-toxic. Low-end brands might add calcium without K2, which can cause hypercalcemia or vessel calcification, as warned in a 2023 Cleveland Clinic article. Or they might use lanolin-based D3 with potential contaminants versus cleaner sources. Lanolin comes from sheep's wool. In contrast, our product hits the sweet spot, high potency D3 and MK7 at research doses with minimal natural extras. It's superior for real health gains. And then lastly, we consider a healthy pH level with everything we formulate. We are the alkalizing company. Vitamin D3 in this supplement helps your body absorb calcium and other minerals that act like natural buffers to neutralize acids, keeping your blood and tissues from becoming too acidic. It also supports kidney function, which plays a big role in regulating your pH by excreting excess acids. Vitamin K2 works alongside D3 by directing calcium to your bones instead of letting it build up elsewhere, which helps maintain mineral balance and prevents issues that could disrupt your pH. Overall, this combination promotes an alkaline environment in the body. And the rice bran acts as a gentle carrier with some extra minerals that can aid in this process. So to wrap up, our vitamin D3 plus K2 is a powerhouse supplement backed by solid recent research. The 250 micrograms of D3 and 125 micrograms of K2 work together to boost immunity, strengthen your bones and joints, enhance your mood and memory, improve coordination, support your pH levels, and optimize calcium use, far outperforming weaker, toxic, or poorly formulated alternatives. So if you're looking to support your health proactively, this is a smart choice. And at the time of this recording, I've asked my team to place our D3 and K2 formula on sale. Please get back to the person who invited you to this overview. They'll share their Essanté Organics link with you, where you may get any of our products at the wholesale price or even less by checking out their on sale now section of their site. Thanks for your time. Have a great evening.